Hey YouTube, my name is Marita and welcome to another edition of the Nurse Lounge. And today it is time to do another Q&A postpartum nursing edition. So it's not just postpartum questions, but I have 4 questions that I've been asked that I think that I should share with everyone. And I do have permission to share, to ask these questions. And so I'm going to jump right on in. All right. So I have questions on here, and then I have a question that was on my one of the comments to one of my videos. And the person who asked the question, she is a fellow nurse and who asked this question. It was a very good question that she asked. And so the question was specifically to postpartum. So she is a postpartum nurse as well. And at her hospital, they do a couplet care. And couplet care, if you don't know, is where one nurse takes care of the mom and baby couplet. So if the mom and the baby. So whereas at my hospital, we take care of just moms and we have a nursery nurse who takes care of the babies. So that's the difference. So her question was this. She said, so if the mom needs help, if I have 6 moms, so like usually when it comes to couplet care, you'll have about 3 to 4 couplets. That is 6 to 8 patients if you think about it. Our ratio is 1 to 6, so I only have up to 6 moms. Or sometimes I have GYN patients too, so I have a mom, a few moms and a GYN or whatever. But my total load is 6 patients, period. So her question was this: if she asked me, who is it who helps those moms with breastfeeding? She said, does somebody else come and do it, or do I do it since I'm the mom's nurse? And the answer was, we have lactation for that. So lactation and nursery handles baby stuff. I am not required to put mom to breast. Have I been trained in it? Yes. Or put baby to breast, not mom to breast, put baby to breast. I've been trained in it, but it's not my responsibility as a postpartum nurse. So as a postpartum nurse, I am there to take care of the mom and the mom only. I medicate the mom. I do things like that. The only thing we do regarding breastfeeding is we give the lanolin cream. So we go ahead and get that off the Pyxis and we give it to mom. But outside of that, the breastfeeding component has nothing to do with me. The only time it does have something to do with me is when the baby is in NICU, and then I get her set up with a breast pump and I kind of walk her through that then. But even then, we have lactation who comes in and makes sure she is pumping and things like that. So I will set that up for her if I have a baby, if the baby's in NICU. Or maybe sometimes our babies get shipped. Maybe the baby was born too early, so it gets shipped to our larger hospital. And I will help mom, pump and give her the instructions on how to pump and how to use the pump and things like that. So that's as far as I go with breastfeeding in general. But can I do breastfeeding information or breastfeeding teaching and help? Yes, I can. And to be honest with you, if I'm not doing anything at the moment, so like let's say I'm in the patient's room and she's saying, hey, I really need help getting this baby latched. Typically I'll say call nursery, but let's just say I have nothing going on at the moment. I will latch baby or I will help her myself. So I will help her and get the baby latched myself, but that's not a requirement of mine as a postpartum nurse to do so. So hopefully hopefully you all understand that. So am I being mean if I say call nursery? No, because that's their job. Their job is to take care of mom, or their job is to take care of baby. And lactation, we have lactation. We have one during the day, and we have one who does mid shift to the beginning of night shift. She doesn't stay the entire night, but she does hit them at the beginning of nights, like 7, 8, 9 o'clock at night, to help them with breastfeeding. And then they have to do it. The nursery nurses take over overnight, and then during the day we have lactation and nursery yet again to help mom with breastfeeding. So nope, I don't have to do it. Nope, I typically don't do it because I have 6 patients I have to take care of, period. And I'm taking care of them regarding their pain meds, making sure they're getting up, making sure they're doing what they need to do, doing whatever interventions, treatments, procedures I need to get done. And I'm doing that times 6 patients, plus doing discharges, plus getting new admissions, plus charting and all that. So that's just not part of my responsibilities. All right, so hopefully that answered that question. My next 4 or 3 questions come from I think she is someone who watches she's someone who watches on YouTube. And she sent these questions to my business email, which I will have that in the description below. So, and she gave me permission also to ask these, or to use this for my Q&A. So the question is, can you be a nurse educator without an MSN degree and just be a DNP or FNP? She wants to know, is it necessary that you get your master's in nursing education when a DNP is higher degree? Can she just do that if this is what she's trying to do? So you cannot be a nurse educator. You cannot have that title without having a master's degree. So she said, or could she just be a FNP? FNP is master's degree. You have to have a master's degree to be a FNP. So you cannot skip to the DNP. You have to go through each level. Now, like I told her, she already knows the answer to these questions because I emailed her back already. But like I told her, you can do what's called a BSN to DNP program, which means you have your BSN and you're trying to obtain your DNP, but they're going to have you take master's levels courses first, and then they'll have you take your DNP classes last. So you still take the master's level courses, you just don't get a degree for your master's degree because you're going from the BSN to the DNP. But you still have to take the master's level courses. So for me personally, if I got to take master's level courses, I want the degree to go with it. I want to say that I definitely got this degree. I want the piece of paper, and then I'll go back for my DNP. But if you all want to do the BSN to DNP, feel free to do so. You will not get a master's degree. You don't get a separate degree for that. You just get a DNP at the end. But no matter which way you do, whether you go to a master's program or do the BSN to DNP, you still have to take master's courses. There's no way to skip from a bachelor's to a DNP because it all builds on the previous degree, if that makes sense. And so she was just saying, can the DNP is higher degree, can she just use that? Nope, you can't. You have to go through the steps. So you go from bachelor's to master's to DNP or to whatever terminal degree that you want to get. But again, you have to take the steps, or you can go from the BSN to DNP degree as a bridge program. They have that bridge program. But again, you do not get an actual master's degree, but you still take all those classes. So it's up to you how you want to do it. But for me personally, if I got to take all these classes, I want to go ahead and get my master's degree. I want the actual degree. I want my paper to say master's in nursing education or whatever. So to be a nurse educator, yes, you have to have a master's degree, and yes, it has to be, said. Now, that's definitely to have the title of nurse educator. My specialty is nursing education. My MSN is in nursing education, so I have that as a degree. Now, as nurses, we teach all the time. You are an educator as an associate prepared nurse. You are an educator, if you think about it. You're teaching as an LPN. You're teaching even as a CNA. But to have that degree title, yes, you have to have a master's degree. Her second question was, I want to become a postpartum mother-baby nurse, but I want to know, is there a lot of young RNs or new grads work in postpartum? Because I've noticed when I went to clinicals, there wasn't any. Now, of course, it depends on your demographic of where you work at or what school you go to or whatever. But yes, there are plenty of new grads, young RNs, and OB, mother-baby, L&D. There's plenty of them. So if you are new, or if you're wanting to come to OB, postpartum L&D, you want to be that kind of nurse, but you are like 20 something and you feel like I won't fit in. Well, it depends on which hospital you go work at. That may be true. But for the most part, yes, you can go to any hospital and they take new grads. If they take new grads, they're going to have young nurses there. And that's perfectly okay. So don't be discouraged because where you went to clinical at didn't have new grads, but they do have new grads, young nurses who do work OB right out of school. I was 26 when I came into OB. So, that's still considered kind of young. So 26 years old as a new grad in OB. I will say this. OB used to be, at least when I first started, an area of nursing that people either died or retired. That's the only way they moved. The only way they got out of that area is because they either died or retired. That's the only way their position came open. But so if you work at a hospital or been to a hospital or something like that, they're all old because don't nobody leave, then that may be true. But for the most part, you can go to most hospitals and you're going to see a combination of young and older nurses, and that's perfectly okay. So yep, that's pretty much how that goes. And then the third question she had was, being a maternity nurse means not, will it is being a maternity nurse means you forget the skills that you learned in nursing school? This is an excellent question. Will you forget the skills you learned in nursing school? Yes and no. And the reason behind that is because OB is a specialty. So therefore, and matter of fact, everything's a specialty. Med surg is general, but it's its own specialty area. You have everything that goes in med surg. You see what I'm saying? So it's a specialty. So of course you're not going to have the same scenarios you've even had in nursing school. We see only women who are having babies. So of course I'm going to do the same things I did in nursing school. So I've probably only dealt with 3 NG tubes my entire 16 years as a nurse. And my patients pull them out every single time. So I'm like, okay, well, if you're going to pull it out, then we're done with it. You know, if you're strong enough to do that, then you can figure out another way to hold this stuff down. So that's kind of how I look at that. So yeah, I mean, you have to be mindful that it's a specialty. So you're going to lose some things. Yes. And if you're fearful of that, then you just need to stay in med surg. If you're fearful, this is what I'm going to say. If you're fearful of losing the basic skills that you learned in nursing school, then stay in go to med surg, and you will have those skills and then some. Me personally, I have no qualms about not having to do NG tubes. None. We don't do trach care because our patients don't require trach care. We don't do ostomies because guess what? Our patients don't have ostomies. Now, you will see patients with ostomies who get pregnant and have babies. So if I did see that, that would be a rarity, and I would relearn how to do that once that time came. So yes, there's a lot of things that I have lost my skills in, but I guarantee you, if I needed help doing something, I have nurses around who could help me do something. Matter of fact, I call a not postpartum, med surg nurse. I said, listen, I got a patient down here on 3rd floor who has a ostomy, and I don't remember how to do this stuff. And typically you have a nurse who'll come down, you don't even know her, come down, or him, from your floor, and they will show you what you need to do. Or I'll call the house supervisor and say, hey, I have a patient with an ostomy. Let's just say I'm working night shift and I don't know how to do this. Somebody will come help you. You should find somebody to come help you learn how to do whatever it is, really, really quick. So yes, I've lost those skills, but I don't mind because I mean, I'm an OB. We don't do that. I put in catheters, take out catheters. I put in IVs, take out IVs. We do dressing changes all the time. We take our own dressing off. We take our own dressings off our patients. I've had wounds that have dehisced and opened back up that I've had to get a wound vac, get an order for a wound vac. I've had to pack dressings and do wet to dry. I've did all those things before, even in OB, because wounds do open up. Think about it like this. OB is a specialized med surg. So, because it's all women. So I do a lot of things that you all do in med surg. We don't have 50,000 meds typically. But we do have patients with comorbidities. I have patients who have diabetes, hypertension, thyroid issues, mental health, drugs, you name it. I got it. And then add on that, if you have all those issues, plus you just had a baby, that makes the situation even worse because now I'm dealing with hormones. I'm dealing with the fact that you're bleeding. I'm dealing with the fact that we have to maintain you OB-wise, make sure you're clear that way, plus handle any med-surg issues or other comorbidities that you actually have. So really, in our situation, it's much more difficult when you have those entities combined with OB. So I hope that answered her question. So yes, you will lose some, but you'll gain some, and it's perfectly okay. So anyway, that concludes. I know this was kind of short and sweet. I only had 4 questions, and I thought it was beyond time. I have not did a Q&A in so long. But those were the 4 most recent questions that I had, and they were great questions. So if you have any questions that you would like to know for my next Q&A, definitely leave those below, or you can email me. The email will be in the description box. You can also follow me on my social media platform of IG. The banner's at the top, plus I have it right here or right here, plus it will be down below in the description box. You can always go over there and DM me your questions, or you can email me in the business email below, or you can just put your question or comment, concern, whatever is down in the description, the comment box down below. So that concludes the video for today of this Q&A. I thank you so much for watching to the end. Until the next time, you all take care. Bye-bye.